Hello everyone, my name is Chanmi, and the gastrointestinal disorder that I chose is liver failure. For this presentation, I reviewed two articles that focus on different aspects of liver disease. The first article talks about how severe hepatitis B flares can progress to liver failure, while the second one examines whether a short educational video can improve disease-related knowledge in patients with decompensated cirrhosis. The first article is a review of the causes, assessment, and management of severe hepatitis B flares. I chose this article because hepatitis B can cause significant liver inflammation and may progress to acute uh, liver failure if it is not recognized and treated early. The article explains that the high hepatitis B viral replication can trigger a strong immune response that damages the hepatocytes. Severe hepatitis B flares may cause very high liver enzyme level, jaundice and impaired coagulation, hepatic decompensation, and even death. One of the important findings from this article is that early treatment with nucleotide analogs may help reduce mortality. If the patient's liver function continues to worsen despite treatment, rescue therapies such as plasma exchange or liver transplantation may be needed. This article emphasizes the importance of recognizing early signs of deterioration instead of waiting until severe liver failure has already developed. The second article talks about whether 4-minute educational video could improve the knowledge in hospitalized patients with decompensated cirrhosis. This was a prospective study involving 50 adults from two hospitals in Canada. The patient has complications such as ascites, variceal bleeding, hepatic encephalopathy, or a combination of these conditions. The researchers found that patients' average knowledge scores increased from 62% before watching the video to 72.5% immediately afterwards. Among the 16 patients who completed the 30-day follow-up, the average knowledge score was 78.8%. However, 22% of the patients did not show immediate improvement after watching the video. I chose this article because patients' education is extremely important for patients with cirrhosis. However, education may not always be effective when it is provided only once or in only one format. Together, these two articles provide important information about patient care management. For a patient experiencing a severe hepatitis B flare, the advanced practice nurse should monitor the patient's hepatitis B vital levels, liver enzymes, bilirubin, coagulation studies, kidney functions, and changes in mental status. The patient should only be assessed for jaundice, bleeding, ascites, worsening fatigue, and signs of hepatic encephalopathy. Patients who show signs of hepatic decompensation may need an urgent referral to hepatologist or liver transplant center. For patients with decompensated cirrhosis, care management should also include monitoring daily weight, abdominal swelling, fluid status, medication adherence, and symptoms such as confusion, gastrointestinal bleeding. Nurses also should determine whether the patients understand how to take the medications, such as lactulose, diuretics, because incorrect medication use may lead to worsening complications or hospital readmission. These studies should provide information about health promotion. Patients with hepatitis B should be also encouraged to take their antiviral medication constantly, avoid alcohol, and attend regular follow-up appointments. Education should include the purpose of antiviral treatment and the importance of continued monitoring, even when the patient feels well. For patients with cirrhosis, health promotion should include education about sodium restriction, daily weight monitoring, medication use, and when to seek medical attention. A short educational video may be helpful, especially for hospitalized patients who receive a large amount of information within a short period. However, I would not rely on the video alone because some patients did not improve after watching it. I would combine the video with the individualized education and teach-back method. Teach-back allows the nurse to identify misunderstandings and provide additional education based on the patient's specific needs. Finally, these articles can help prevent the further disease and complications. Early treatment of hepatitis B flares may prevent the progression to severe liver failure. For patients with cirrhosis, effective education may help them recognize worsening ascites, confusion, bleeding, or rapid weight gain as before the condition becomes an emergency. Standardized education before discharge may also help prevent complications and reduce avoidable hospital readmission. So overall, these articles show that preventing liver failure requires both early medical treatment and effective patient education. As an advanced practice nurse, I would use this evidence to support close monitoring, timely referrals, and standardized patient education that is reinforced through the teach back and follow up. Thank you.